Today is Friday, January 27th, 2023. This is a regular meeting of the Finance and Government Operations Committee at 70 West Heading Street, San Jose, 10 o'clock a.m.
Hello, good morning. Welcome, everybody. I would like to go ahead and call the FGOC, the Finance Government Operations Committee, to order. I am Supervisor Otto Lee, chairing of this committee, and I would like to also welcome our new Vice Chair, Supervisor Susan Ellenberg. To remind the public, our committee assignments may rotate on an annual basis based on the assignments we are given by the sitting board president. So before we call for quorum, I'd like to thank Supervisor Cindy Chavez for her services serving as the FGOC Vice Chair this past year. Supervisor Chavez is now serving as the Chair for the Children, Seniors, and Families Committee and also as a Vice Chair for the Public Safety and Justice Committee. And having said all that, I would like to acknowledge that both members are present to kick off the meeting, and we have a quorum. Second, go to agenda item number 2, which is the public comment. And this item is reserved for members of the public to address the committee on any items that's not on this agenda. And any public who wish to address the committee on items not on the agenda should request to speak at this time. The law doesn't permit the committee actions extended discussion on any items that's not on the agenda. And so if committee actions requested, the committee may place that matter on the future agenda. Statements that require response may be referred to staff for reply in writing. And clerk, would you please let us know how many speakers we have for public comment today?
I currently have no requests.
Okay, I'll give it 5 more seconds. Okay, and right now this meeting is still held in person only, correct? But I heard some good news that we might be able to get to hybrid soon. So we'll talk about that later. Going to item number 3, which is to approve the consent calendar and changes to the committee's agenda. Items that are removed from the consent calendar will be considered at the end of the regular agenda for discussion. The committee may also add items on the regular agenda to the consent calendar. Notice to the public is that there's no separate discussion of consent calendar items, and the recommended actions are voted on in one action. If an item is approved on the consent vote, the specific action is recommended by staff and it will be adopted. I would like to also suggest that for the consent to add item number 6 onto consent, which has to do with the report from the Facilities and Fleet Department relating to the impact of reducing electric vehicle charging station fees. And I would also like to remind the public that there are new dates to the FGOC calendar, which is listed as item 12 on the agenda. And the Vice Chair Ellenberg, do you have any items you would like to include on the consent calendar?
I don't. I'm happy to move approval of the consent calendar as published with the addition of item 6.
Great, I'll now go in second. Right, and before the vote, I'll ask, is there any members of the public who would wish to address the committee on the consent calendar items? They should comment now.
I have no requests.
Okay, we've got a quiet morning so far. So, all right, if that's the case, let's go ahead and take the vote.
Vice Chairperson Ellenberg?
Yes.
Chairperson Lee?
Yes, as well. Moving very quickly to item number 4. Item number 4 on the agenda is consider recommendations relating to Management Audit Division regarding the status of activities at mid-year and consider amendments to the division's fiscal year 2022 to 2023 work plan. And I believe to present this item today in person is Cheryl Soloff, our Management Audit Manager. Good morning, Cheryl.
Good morning. Thank you. So this report that is on your agenda is item 4. It provides 3 things. First, it's a status update of where we are at the midpoint of the year with our current work plan, and then it also operationalizes the action taken by the board in October to amend our task plan, our annual work plan to provide for an analysis of the cost of beds, mental health and drug treatment beds within the county. And then the third thing that this report attempts to do is to reallocate 300 hours from the existing management audit of the district attorney's consumer protection unit to budget review. But those hours could be not reallocated, or they could be reallocated to something else. I'm happy to take any questions that you may have.
Okay, thank you for your report, Cheryl, and for answering some of the questions I have earlier. Actually, Vice Chair Allenberg, do you like to have any questions first, or do you want to open public hearing first?
At your preference.
Okay, sure. If you're ready, go ahead and ask the questions, and I think it'll be helpful for the public here as well.
Sure. Thank you, Cheryl, very much, and to the Harvey Rose team for the request and the report. I really appreciate the thoughtfulness that you're applying to the work plan this year, and I wholeheartedly support the changes. I think this proposal now aligns with the board's priorities. I certainly acknowledge the challenge of the condensed timeline for budget review, so thank you in advance for your forbearance there. I am glad that we'll have a full week of board and public review of the recommended budget, so everything is a balance. I really appreciate the proposed adjustments, and I would move approval of the recommendation.
Okay, thank you, Vice Chair. So Cheryl, yeah, it's been relayed to me that the, oh, yes, yeah, you have got a motion to approve, and I'll go ahead and second it for now, thank you. So Cheryl, it's been relayed to me that the news work hours stem from having surplus hours from the management audit of the DA's Consumer Protection Unit was due to mix of various things, including this overestimation of hours, having to do with some tasks that could not be carried out because of some limitations of disclosure issues. And I certainly agree that the reallocating these hours so you can spend more time reviewing the recommended budget along with the cost of the mental health beds of the MC is a good use of reallocations. So that's really the only comments I have. Do you have any further comments on that, Cheryl?
I don't have any further comments.
Okay, all right, good. I'll go and open up the public hearing. Any public? No, we did that already. Nope.
I have no requests for this
Still,
item.
still nothing. Okay, all right. If that's the case, we got a motion. We got a second, and let's go and take the vote.
Vice Chairperson Ellenberg?
Yes.
Chairperson Lee?
Yes, as well.
Thank you.
Thank you. We're moving a little faster than I normally expect, so that's why I'm hesitating for a second. All right, good. Going to item number 5, receiving report from the Behavioral Health Services Department relating to an opioid settlement and bankruptcy expenditure plan. And I believe today we have Dr. Sherry Terrell, the Director of our Behavioral Health Services Department, and her team, along with our County Council as well. Oh. Good morning. I'm not sure
Edwin, I
the
think
mic
your
is
mic-
working, Edwin. Can you try it again?
I'm on. Okay, does that sound better?
There you go, Edwin.
Okay,
Good.
thank you. Good morning, supervisors. My name is Edwin Poon. I am the Deputy Director with the Behavioral Health Services Department, overseeing the managed care operations, and I'm also the Alcohol and Other Drug Administrator for the County of Santa Clara. So I'm happy to be here this morning to present to you on this report on behalf of the department.
Great, thank you.
So first of all, I just want to thank you the opportunity to review the frameworks that we have in terms of using the opioid settlement funds that the county is receiving to support the expanded service for those who are struggling with opioid addictions and other substance use disorder in our community, and also utilizing the fund to lessen the future impact of the availability of these drugs and how it's became such a significant issues for our county, but also nationally in terms of the opioid epidemic. So this report is provided in response to a December 6th Board of Supervisor meeting requesting the Behavioral Health Department to provide a report back on recommendations on the use of the opioid settlement funds, which also include a process of obtaining community feedback on using the funds to effectively address the issue in Santa Clara County. And so I would like to start with a reviewing of the funding anticipated by the county. Can we move to the next slide? Oh, actually, that's the slide. I apologize. Can you go back? Yeah.
Good morning. I'm Laura Trice, Deputy County Counsel. So we currently have 2 completed settlements that will be providing funds to the county for use in treatment, prevention, and other efforts to address the opioid crisis. Those are the distributor settlement and the Janssen settlement. The funds from these settlements will be paid out over a fairly lengthy time horizon. There'll be 18 payments over 18 years for the distributor settlement, 11 payments over what will probably turn out to be 9 years for the Janssen settlement. And we estimate that the county could receive a maximum of about $48 million over the life of these agreements. We have already started receiving funds from these settlements. The county received the first 2 payments from the distributor settlement in November and December. Those amounted to about $3.6 million. And we expect to receive the first 2 payments from the Janssen settlement probably in late February. And we do have some updated information about those payments. We have received notice that those should be about $2.083 million. So that's a little bit more than is listed in the slide. After we get those initial payments, we should be on a more regular once-a-year payment schedule for these settlements. We should probably get the next payment sometime in the summer or fall of this year, and then we'll get them annually thereafter. The funds do have some time limits. They don't have to be spent immediately, but generally they need to be expended or encumbered within 5 years, except that if the funds have been designated to support a capital outlay project, they could get a little bit more time. They have to be expended or encumbered within 7 years. And if they're not expended or encumbered within those timeframes, the funds will transfer to the state and the county would not be able to use them.
So we'll move on to the next slide. So to start off with the process, we're proposing what we call the phased approach that we're going to establish to have a community input process really through a partnership with our public health department. What we really wanted to do is to make sure that we gain stakeholders' input, both from a long-term as well as short-term planning perspective, as well as focusing on establishing a broader framework for other strategies to address the needs of the individual. It's going to be most effectively with the opioid addiction. We also wanted to make sure that the strategies are going to be aligned with the broader needs of the community around substance use disorders. Some of the key partners that we have already started the engagement or considering the engagement in the strategic planning include the Fentanyl Task Force. There's also the Santa Clara County Opioid Overdose Prevention Program, Drug Users Health Advisory Council, of course, the Behavioral Health Department, and also our community partners. We'll also be considering inputs from individuals who are currently users, as well as former users of opioids and now in recovery. We'll also be considering expanding outreach and participation to other groups as part of this effort. With the support of the board, a portion of the funds will be utilized to support these planning efforts, which will be jointly by the Department of Behavioral Health as well as Public Health, with the Public Health having a lead role. Separate from the planning process, there are going to be certain key initiatives that we've been identified as high impact that is already existed today and that we're proposing to make some immediate investment to address. And if you can move to the next slide. So this slide highlights some of these framework initial works that we would like to pursue. The first one is the need for a more data-driven decision-making, and we believe that in order for us to make these critical decisions, strategic planning, that having a very strong data-driven approach is really necessary to be effective. So that's why we're proposing investing a portion of the funds to strengthen our data collections to support this informed decision-making process and recommendations. We would like to utilize data to help us to determine effectiveness of interventions and prevention strategies, working on future modifications of programming. All of that data-driven work will be led by the Public Health Department. Second, we wanted to expand our service to youth in the school system. This is also part of our initial recommendation. We want to focus the use on funds to target youth through our prevention efforts. And what we know is that approximately 1 in 5 youth deaths last year were due to fentanyl overdose, and this trend continued to go upwards. Service within the schools will be expanded, and those services areas considered high risk will continue to be prioritized. And this will include consultation services to teachers and administration. The third one that we are recommending is to use a portion of the funds to continue and expand the county's efforts at the naloxone kit and fentanyl test strip distribution throughout the county. That include training and the use of these critical items with staff and those who have the opportunity to use them. We know that this is a priority of the governor, and the county will leverage these funds to with the anticipated additional funds from the legislature to expand this current effort. The next item has to do with the medication-assisted treatment program, and there are a number of areas in the counties where we believe that will benefit from an expansion of medication-assisted treatment program on an outpatient basis in the community and potentially embedded even in the primary care settings. We are proposing to dedicate a portion of these funds to support this effort. The next one has to do with expanding youth substance use disorder residential services. We know that residential substance use services is becoming a growing need and has developed much slower than comparable services for adults statewide. So a portion of the funding is proposed to be used to expand contracted beds for these services for youth. And then last but not least, as the part of this initial framework, is to expand the clinical expertise available to the Behavioral Health Services Department to oversee the expansion of these services through the establishment of a medical director position to oversee the drug Medi-Cal organized delivery system with the hiring of an addiction specialist to provide expert consultations and oversee the system improvement just to help us to move these very important items along. The medical directors we propose will be working very closely with our public health department to implement all of these recommendations. This is the presentation we have for you today, and so at this time we're happy to answer any questions or provide any additional information that you may have, that you're looking for. Thank you.
Thank you very much, Edwin. Vice Chair Allenberg, any questions on this one?
I do have some questions. Thank you very much, Edwin, for the report, as well as Sherry Terrell and the behavioral health staff, and Laura Trice from the County Counsel's Office. I really appreciate the work that went into the plan and the broad strategies that are outlined. On page 4, the ledge file states a goal of expanding medication-assisted treatment, MAT, services to support underserved areas of the county where there is unmet need and partner with neighboring counties as appropriate. Could you expand a little bit on what you're envisioning here and what drove that particular recommendation?
Sure. So there are a couple ways that we really wanted to address the unmet needs. One has to do with looking at our geographical locations and where our currently MAT is offered in various different locations within the county. So from a geographical standpoint, we do recognize that perhaps in our northern part of our county, that there are potentially some gaps in terms of availability, and we currently have have been in talks with our counterparts over at San Mateo County to see if we can strategically place a MAT clinic in, between our border, within the border of the two counties, as one way to really support each other in expanding the services for MAT.
Do the services exist in southern San Mateo County?
There is currently, the Behavioral Health Service Department currently contract with a vendor that offer NTP, Narcotic Treatment Program, which also offer MAT. So it is there. So we do have a contracted provider that it's currently located in San Mateo County. I think it's in Palo Alto, at East Palo Alto. So we do utilize that particular vendor or provider to service our county needs. But we also going to also take a look at our needs. So we realize that in addition to just looking geographically, we'll also be assessing in terms of the referrals and the needs where they are located throughout the county to make sure that we balance out also the population and the specific needs in our area to make sure that the resources are allocated in a way that's going to maximize the benefits.
Thank you. I really appreciate that information. And speaking of balancing, I also want to make sure that we're balancing both prevention and treatment for substance use disorders in our strategies. Items 2 and 3 are more prevention focused, 4 and 5 are more treatment focused. Clearly, our substance use disorder needs will go well beyond the revenues that are available from the settlement funds. And it's not important necessarily to me that this framework distribute resources evenly across the prevention and treatment focused strategies within just the available settlement funds, but that we're using the settlement funds strategically in line with the mix of grant and ARPA and Medi-Cal and any other resources to advance both prevention and treatment. Certainly the board and the public would like and need visibility on the amount of funding to be applied to the strategies from settlement funds and other sources going forward. And I may suggest some direction to that effect in a moment. But for item 5, in the framework on youth substance treatment use, substance use treatment services, will this be additive to the 5 beds for youth withdrawal management that the board approved last June?
Good morning. Can you hear me?
Barely.
Good morning, Supervisor
Thank you.
Ellenberg. This is Delia Faria-Costa, Director of Children, Youth, and Family System of Care with Behavioral Health. Yes, to answer your question, these funds will provide additional services to existing services that were put in place with the approval of the board. So we are looking to expand and add services.
Excellent. And those, thanks, Delia. Those 5 beds that were approved, are those up and running?
Actually, what we ended up doing with the withdrawal management, we added residential services because withdrawal management services is actually not a certification offered by the state for that ASAM level of care, and youth can benefit much more for the 30-day residential services rather than a 5-day stay. So we ended up adding residential services.
Is that as an alternative to a youth detox
Yes.
program?
Yes.
Oh,
Because
that's
the
really
services are
interesting.
more intensive and they're more supportive. There's more family engagement. So we thought it would be a good addition for youth services. So these additional funds will add additional residential beds.
Oh, good.
Same.
And are the settlement funds now being applied to that already identified need, or on top of those 5 planned beds?
I'm sorry, can you repeat the question?
Are the initial 5 planned beds, are those being funded with settlement funds, or just the additional ones? Do those have another funding source?
It's a different funding source. So we're planning to add 4 additional residential beds with the opioid settlement funds.
Got it. Thank you. I really appreciate that. I'd like to make a motion to forward this item to the the full Board of Services with a favorable recommendation and incorporate comments from this meeting today, later today from CFC, whatever those may be. I understand you're presenting the same report. And to include, when you bring it to the board, please, a specific distribution of expected funds, either by percentage across the framework priorities or funds for the current year. And also to please specifically address the opioid settlement revenues received and planned expenditures in the CEO's recommended budget. And I would ask for a second.
Yes, definitely second that, and I certainly do have some further questions and comments on this as well. Thank you very much for the good report here. The first question I have is actually related to the dollar amount itself, and try to help me understand this, Edwin, is that the total amount that the state would be getting is about $2.2 billion, and it says that our max that we would get as our county is $48 million. Do you know if this is given to us pro rata based on population? Because this looks like we're not getting our fair share. You just look at the numbers of people. So could you help me explain that? Yeah.
The answer to
Thank
that.
you.
I can try to respond to that question. Thank you, Supervisor. So it's not exactly pro rata by population. 15% of the total funds go to the state. So none of those funds will at least directly make their way to the county. I mean, there may be state grant funding that ultimately makes its way to the county, but they won't directly come to us. 85% of the funds will be allocated directly to cities and counties. So in terms of population, you have, the cities have their portion of the incorporated population. We have the incorporated, unincorporated, so there's a little bit of double counting in terms of the populations. But in addition to that, there was a specific allocation formula devised in the national opioid litigation by experts. And the goal of that allocation was to ensure that funds from the settlements flow to where there is the greatest need, not only where there is the greatest population. And so the allocation model that was developed in the litigation incorporates things like the number of opioid prescriptions that were shipped into a county, the number of, estimated number of people with opioid use disorder, that kind of thing. So it's not, population is a part of it, but it's not the whole equation. And there is a intrastate allocation agreement between California and local governments that the board approved at the same time that the board decided to enter into the settlements. And that includes a long list of percentages for every county and city that's eligible to participate. And if you look at those, you can see there's a pretty good correlation with population when you take into account city populations, but there is a little bit of variation given the need to take into account which jurisdictions have been hit hardest by the opioid crisis. So the county ends up with about, I think, 2.5% of all of the funds that are flowing to cities and counties.
Right. Thank you. No, that's very helpful to understand why it's not that simple to calculate the numbers. Thank you. And Daria, thank you so much for the explanation. Actually, I'm extremely interested in trying to understand the differences. So earlier you mentioned that the residential services beds as differing from the withdrawal services. You said one is 5 days of services versus one is 30 days, which is more intensive for family engagement and all that. So, so dialing back, so the funds that we are able to allocate from here, you mentioned something about 4 residential beds. So those are the additional 4 that we're talking about, and I believe. Let me see. So reading the the report and following it with staff's answers, we currently have 8 beds, right, for the youth substance use disorder residential services. So of the 8, so by adding these 4, then it will go up to 12. Is that correct?
Yes, that would be correct.
Okay, great. Now, on the 8 right now, do you have any idea how the utilization rate is? Are they basically full every day, or do you have any data on that?
They're not full every day, so we still have capacity. So it really depends on the number of referrals that we're receiving. Primarily, we receive a lot of referrals from probation officers, but also from within our system of care. We have outpatient services where our clinicians are working directly with families, and sometimes they are making those referrals directly for the residential beds, but we have been able to manage the number of referrals that we've been receiving, and so we feel that this expansion will be very helpful, but we have been able to manage it.
Great. Given how big we are of 2 million people, it seems like 8 beds for our youth seems to be very low given the pandemic we're dealing with right now. So besides through probation and clinicians, is there a way for family members who realizes their kids are family members that would need the service? Is there a direct way that they could actually connect through a phone number or somewhere to call?
Do you mean if family members can make direct referrals for?
Right, or request that type of services?
They can definitely request, and we do an assessment for the level of care that's needed. It is a requirement for Medi-Cal.
Sure, for Medi-Cal,
Yeah.
to get to, in order to get in the system, they need to be assessed, I understand. So where would they do, or who would they call to get started on this program? If they have
Well,
questions?
they could call the call center, but I think that what it ends up happening is that families are requesting services for their youth, and we start with outpatient services or intensive outpatient services and make those assessments to the level of need, engaging the families. Engagement is really key when we're dealing with young people, because many times they're not voluntarily wanting to go into residential treatment services. So we do a lot of family work and engagement to make sure that everyone is on the same page about the services and what they're going to entail. But families can definitely call the school personnel, and our own clinicians who work with these families as well.
Right, because one thing I do know with adult substance abuse or substance use situation, the voluntary part of it is the key, and a lot of times they might be interested one day, but they are not 2 days later, right? But with family, being these are youths, which they're still not over 18, if the family is willing to put the kids into the system, that legality on this is a little bit different, where if the family wants to put the kids in there, then I don't think the child would be able to say, no, I don't want to do this. Is that correct?
I'm going to say yes and no. It's complicated.
Like everything else.
It's complicated because, there are times where the families are wanting their child to be in services. We are able to accommodate the request, the child meets the need, and then they go into the service, they run away. So there's all sorts
Right.
of issues
Sure,
that.
of course, right.
So the key really is the family treatment and the engagement with the entire family.
Right.
So we like to think of our services as person-centered and family-driven. And that is the philosophy that we approach all of our treatment services. So definitely it's a family decision.
Right. So basically, I'm absolutely ecstatic the fact that we're going to increase these 4 beds, but I guess at the same time, I'm really concerned is let's make sure that utilization rate is going up to fill up those beds. And the fact that whether it's outreach or discussion with the physicians community or whatnot, to make sure that the family knows how to get in to ask for these services. Because I definitely do think that given the explosion of the usage of these drugs right now in our community, not just fentanyl, but so many different things right now, that this would be very, very helpful to get the kids out of this cycle. All right, so the report also referenced a high-risk area map, and looking at the map, it says it's 2019, but actually the data is also used from previous fiscal year on a report that says, quote, high schools would be prioritized based on the current high-risk area map. Given the COVID pandemic over the past few years, I think there probably is quite a few things been changed. And then, from my understanding, is that some of the data that they rely on, even since 2019, actually could come in even 4 or 5 years prior. So I just want to see if it's time for us to see if we could get some new data from the field to look at, so that to make sure that we are really hitting the area that the risk is increased. As we know, the fact that the new fentanyl is fairly recent, and I think that's only affecting somewhat different area of the county as well. So I think that would be interesting to see. And then one
Supervisor
other
Lee?
question I have is also, how does the administration feel about using this map to prioritize a high school for expansion plan, and when do you think this update can happen?
Thank you for your comments, Supervisor Lee. We're actually started the process of updating the high-risk map, so we will be using that map once it's ready.
Great.
And we can use the 2019 as a starting point for conversations, but we're definitely in process of updating the map.
Okay, great. We currently, our county has, as stated in the report, we have the fentanyl task force. We have the Santa Clara County opioid overdose prevention program, or they call SCOOP. And we also have the Drug Users Health Advisory Council. Could you help us understand the different role, and then whether or not do you think there's any overlap in these roles that we could be able to combine and have it work better synergistically?
Sure, I can speak to that, Supervisor. So the fentanyl task force is what we call an intra-county coordination effort, which is actually led by our district attorney's office and also the medical examiner's coroner's office. And that task force was created back in 2019 to specifically respond to the fentanyl-related death. I think that the participants of that particular task force include the county agencies such as the DAO, the MEC, the Behavioral Health Services Department, as well as law enforcement agencies. So that particular task force, the really focus is to review the data from the coroner's office, the crime lab, to really understand the fentanyl crisis. The other groups that I mentioned is the Santa Clara County Opioid Overdose Prevention Program. And that one was actually created a few years back, and that's 2015, through the department under the guidance of the directions of the addiction medicine, and in also collaboration with Stanford University. Addiction Medicine Services. Is that particular group really brings all the community members together to prevent the overuse and misuse of opioids. And so that's a broader group that includes, again, the Behavioral Health Services Department, Public Health Department, prevention, and many of our local community clinics and providers, and also the local insurance payer, and that includes Blue Cross, Family Health Plan, and then law enforcement. So it's a very diverse group of people coming together, addressing as a community needs. The third groups that I mentioned in the report is the Drug User Health Advisory Council, and that is coordinated by the Public Health Department's Harm Reduction Program. And that particular group exists basically to provide community guidance and accountability to the harm reduction program to enhance the coordinations with all the overlapping services and advocacy. So that group also have many different participants, including the Behavioral Health Services Department, but also Office of Supportive Housing, Custody Health, Bay Area Community Health, some of the other, again, local community clinics. The hospital system, Stanford, is part of this, Bill Wilson Center, and even some of our contract providers such as Momentum Health. In terms of the overlap, while I think that these bodies have similar agencies to participate, but I think that the mission of each of them is very focused and different. And so we believe that bringing these groups together, making sure that there is really a strong alliance from our strategic planning process is going to be really important, because we want to make sure that any decision as to planning, both short-term again and as well as long-term, is that we have engaged in this stakeholder input process to make sure that it reflects what the community needs are. So that's what we're looking for.
Well, thank you very much for the very comprehensive explanation on these three different groups. And I certainly want to make sure that they are collaboratively working with each other and not become stovepipes that not talk to each other. So I just want to make sure that exists. If there's any coordinations needed from our county's perspective to make sure that they are talking to each other, that would be great. Yep. Okay. I think that's all the questions I have. Now I'll go and open a public hearing. How many the public would like to speak today?
I have no requests.
Okay, I'll go ahead and close the public hearing. And we do have a motion and a second, and I'll go ahead and take the vote.
Vice Chairperson Ellenberg,
Yes.
Chairperson Lee.
Yes as well.
Thank you.
Thank you very much. It's always exciting to get more money to put into services as needed in our community. Okay. Item number 6 has been put on consent, so we move to item number 7, which is receiving the report from the Office of County Executive and the Facilities and Fleet Department relating to status of the Fairgrounds Master Planning process. I believe today we have Mr. Glenn Williams, our Asset Development Manager, and also Abe Andrade, the Executive Director of Fairgrounds Management Corporation. And I see also Don Rocha, the Directors of Parks and Recreation, here with us as well. So I'll let them situate it. I see Mr. Williams is a big Niner fan.
Good morning,
Good morning.
and welcome into the Lion's Den, Supervisor Ellenberg. This is the normal monthly report made to the FGOC on behalf of the future master planning for the county fairgrounds. There are essentially 5 parts to this report, one of which is for parks and their planning efforts with WRT, and Don Rocha is here to speak if you have questions on any of that. There's also 3 ENAs that have been issued, one for the San Jose earthquakes, for a 35-acre soccer complex, one with American Cricket Enterprises for a professional cricket stadium, and one with San Jose State University for a track and field facility that commemorates the 1968 Olympics and the efforts therein. And the 5th piece is the standard report from FMC on other aspects of the fairgrounds operations. If you are comfortable doing so, I'll open it up to questions. If you wish for me to go through and make a presentation, I can do that as well.
Yeah, no, actually, I have no preference, Vice Chair Ellenberg. Would you like to hear the report presentation?
I've read the report. I'm happy to go to
You're happy to go
questions.
through.
And I know
Okay.
the report is part of the public record.
Exactly, that's right, yeah. So I'll go ahead and open up actually, is there any in the public who would like to speak on this today?
I have no requests.
Oh, okay, good. We're going to close that. Vice Chair Ellenberg, do you have any questions?
I do. Thank you all for the report. And Abe, it's nice to see you. I'm really optimistic about the future of the fairgrounds. And even though this property sits outside my district, my office receives a pretty steady stream of emails and calls. And that's been the case for the full 4 years about the fairgrounds and its potential uses. And what I'd like to do is be able to provide a link that takes people to a page that has background and context regarding the current plans for the fairgrounds. So I'm wondering if you can tell me what the plan is to update the fairgrounds webpage to reflect current plans and updates, particularly as so many people are focused on it and we're hearing this report every month.
Board member, I am Abe Andrade, Executive Director, Santa Clara County Fairgrounds Management Corporation. Yes, I'm happy to say that we are working with our website management consultant to update and to integrate all the various E&As and planning that is currently in the process to keep our community informed of the future plans of the fairgrounds. In addition, we continue to provide a monthly newsletter to the community as well, just informing them of the various activities that are happening on a month-to-month basis. I'm very, very happy to report out that in 2023, for the first time in 3 years, we will have a full fair, Santa Clara County Fair, and it'll be it's going to be county-wide, fair strong, and we're looking forward to returning not only fully with the full fair, but also a 10-day fair this year, which will be from July 26th through August 6th. And so we really want to get that message out, so we look to make sure that everyone is informed about that.
That's very exciting news. What is the estimated timeline on an up-to-date website?
I believe within the it's within the month that we can get that information on our website.
Oh, fantastic. So maybe at next month's report, you can walk us through the newly designed website.
Absolutely. We'll bring that back to you.
Thank you very much.
Thank you.
Well, first of all, very exciting to hear that we have a county fair, and I'm glad that you pick a date that my birthday will be in the middle of it. So, but in all seriousness, I just want to say thank you for the report, and I want to echo my vice chair's point that I think it's really important to keep the public informed what's going on, and certainly website is one of the easiest way to do it. So thanks for making the effort to make the update to keep folks informed of what we're working on. Do I have a motion to accept the report?
So moved, with the added request that next month's report include the updated website.
Exactly, and I'll go ahead and second that. Let's take the vote.
Vice Chairperson Ellenberg?
Yes.
Chairperson Lee?
Yes as well. Thank you.
Thank you very much.
And then we'll go ahead and move to item number 8, which is to receive the annual report from the Facilities and Fleet Department relating to cafeteria and food services management. And I believe for this item, we have Justin from the Fleet and Facility Department, along with Martha Wapinski, Deputy Director, actually Deputy County Executive, to answer my question. Good morning.
Good morning, Supervisors. Justin Sidhu, Senior Management Analyst with Facilities and Fleet, and I'm joined by Martha Wapinski, Deputy County Executive, and we're available for any questions you have on the report.
Great. Thank you very much. I'll go ahead and ask the Vice Chair, you would like to start with a question first?
Sure. Thanks for the report in the agenda. This is an issue that strikes me as significant on two fronts. First, I would very strongly support a program that employs individuals who are exiting our carceral system and puts them on track to culinary or hospitality or food service careers. Second, I know that our employees at 70 West Heading are missing not only the cafeteria service, but lamenting the continued absence of the farmers market. And as we think about, as we are always thinking about being an employer of choice and employee well-being, I think that providing on-site meal and snack options should be a very basic service, and one that can certainly be accomplished in numerous ways. The report was extraordinarily brief, and I would offer to continue this item to the next FGOC meeting so that staff can prepare a comprehensive plan. Dr. Smith, do you want to add in anything about when you're expecting plans and an actual delivery of food service at on campus at the building?
I think the issue of hiring a provider or vendor into the kitchen has constantly been a problem, mostly related to their ability to be profitable, so I won't predict a time for that. But I think from the perspective of realigning the weekly farmers market, I think we can get moving on that pretty rapidly, because the only reason for that to be canceled was COVID.
Looks like Greta has something to add.
I was just going to add, I don't know if Martha wanted to talk about the timeline for the specific infrastructure around our workforce-related program for folks that we're hoping is going to be in place as quickly as possible down there.
Which would eliminate the vendor issue, right?
Yeah, just more broadly, you know, when we were trying to, we have a lot of requirements for the vendor that operates in the basement of the cafeteria, and where that wasn't going to be part of an actual program, it was difficult for them to both meet all of our requirements and sell enough food at volume to be in the black. So it has been very challenging when we were using kind of the older model to make sure that we could actually get a vendor in there who would then stay longer term. And so in addition to the wonderful workforce benefits associated with creating employment opportunities for folks who have involvement in the justice system, we also hope that it gives us a vehicle to supplement a bit what is the cost of doing business while meeting all of our requirements, because it's advancing another county goal. But let me turn it over to our Martha and our team to present on this, see if they have anything to add.
Sure. So for next steps, we plan to bring a request to the board in late February, early March 23 for the contract, for the consultant, the contractor for the cafeteria services and the culinary academy. So in advance of that, what's happening right now is we have a biweekly meeting with a cafeteria stakeholder group with the consultant, FAF, procurement, county council, to work on all the things leading up to implementing something like this. And then this month, we're working with the contractor on preparing a scope of work in the budget that'll go in that report to the board. And then finally, FAF and the consultant and other partners are doing kitchen walkthroughs because, of course, the equipment hasn't been used in a while. So they're doing a facility assessment and an equipment assessment as well. And also, I'll stop there.
I appreciate that. It makes me less interested in continuing the item, but none of that was in the report. So I'm glad to hear that verbally. Have we looked at other models as well? I know Delancey Street has been operating for decades in San Francisco in partnership with Larkin Street. So I know that we're not creating something that hasn't happened before. I'm very glad that something is coming to the board. You said February or March?
Correct. And I know that I'm pinch hitting for Javier Aguirre today, but he has looked at other models. I can't say Delancey particularly, but I'm assuming yes. And so as I mentioned, after the board approves the contract in late February, early March, the contractor will then be working on hiring, menu preparation, and then implementation of the actual operation. We're hoping for a soft opening in about 5 to 6 months after the contract is approved by the board. And after that soft opening, it'll be a 1-year pilot. You know, we'll do an assessment, see how it's working, put it out for formal solicitation, but that's generally the plan at this point.
So we're looking at least another 7 or 8 months, best case,
Like late summer.
before there's food regularly available here. So I would encourage, in the interim, to think about easy and convenient solutions, a farmer's market several times a week, space for food trucks to park, something so that we can offer on-site food for our employees. I just think that it's an important piece as we're coming back from the pandemic and trying to make sure that people are certainly not hangry during the day, and have that convenience as close as possible. So
Absolutely.
thank you very much. And I would then just move approval of the report today and not continue the item.
Yes, and I certainly second that as well. We certainly don't want to have hangry staff members in this building or else any of our employees for that matter. Yesterday, I was able to speak regarding the Reentry Social Enterprise Program right here just exactly a day ago, and how the ESCs is being worked on with the REDF and all that. And does that program has anything to do with this proposal of having the former incarcerated residents of our county to be working here? Is there something to do with that, or are those going to be individuals who are already or currently being incarcerated that is doing the cooking?
I don't have that information with me, but I'm happy to follow up with Javier and get that for you.
Okay, yeah, Javier certainly is the expert on that, and I certainly want to say that this a very exciting program because of the fact that this is exactly what is needed, and I certainly do think that this is an excellent training opportunity. I do know one thing from talking to my staff is that one of my predecessor, Dave Cortese, who has oftentimes hosted events or lunches, whatnot, at the building. He would not announce it, but after the meals is being served and after people finish eating the food, they say, this is actually cooked at our facilities inside the jail, for example. So this is exactly what those who are in the system eating today, and you get to eat and get your taste of it. I think those are certainly really good ideas to showcase the talents that we have actually in that sense, and then the training facility. So I think this is certainly something that we want to promote. In terms of timing, you mentioned February, late February, March is when they will look at it, but we certainly don't have any hard date we will see food being served at the cafeteria at this point yet. Is that correct?
Right. Once we develop the contract and the scope with Rebecca Children's Services, we'll have a better idea and hopefully have come with a better schedule for you when we return to the board in late February, early March.
Okay. And Jeff, I think I've spoken with you on this previously on the potential of a coffee cart of some sort in the building so that people don't have to venture outside the building to look for, say, something as simple as coffee. I know they finally have a Starbucks across the City Hall in San Jose. Not saying I want Starbucks. That's absolutely not my point. My point is that they do have a
Local.
establishment of a coffee and those type of foods available for making sure that the San Jose city employees not getting hungry over there. So I just want to see what's our plan in terms of implementing something like that down the road.
We would have to come up with a plan to do an RFP, so we'll have to come back to you with that.
Okay, all right, so something that we could add on to that discussion, I think that could be very helpful. I'm sure will be appreciated by our staff here as well. Okay, we talked about the cafeteria of this building. How about the cafeterias of the other county facilities? I believe there's something over in Charcot as well. And any other areas. Martha, can you help me understand how those works over there?
Sure, we can come back with some sort of report and plan for those.
For the other buildings where they do have cafeteria. Okay, very good. All right, and I think we checked. There's no public like to speak on this item. Correct?
That's correct.
Okay, we've got a motion with second. Let's go take the vote.
Vice Chairperson Ellenberg?
Yes.
Chairperson Lee?
Yes, as well. Okay, moving along quickly today. How about item number 9 is regarding the report from the Office of County Executive relating to tobacco settlement revenue. I'm here to present, I believe, let's see.
Myself.
Oh, Greg is here. Greg Uturia, the county's budget director. Good morning.
Yeah, thank you. Good morning, Chairman and Vice Chair. My name is Greg Uturia, a County Budget Director, and this report is in response to discussion that occurred at CSFC in December when there was an informational report on the county's tobacco settlement revenue stream and a decision made in 2007 to sell that future revenue stream between 2026 and 2046. And during that meeting, there was a request to staff to go back and take a look and come back to this committee to report if there are any other revenue streams that have been sold for the future. And we did that investigation with the finance agency staff, and we, affirmed that there is no other condition where a future revenue stream has been sold. And so this is report to that effect, and see if there's any questions from the committee.
Thank you, Greg. Vice Chair Ellenberg, you have any questions?
No questions on this item. Thank you, Greg, for the report.
Okay, do you have a motion to accept the report?
So moved.
Now I'll go ahead and second that. Well, I'll go ahead and ask to see if there's any public who would like to speak on this item.
I have no requests.
Okay, good, thank you. Just my brief comment is earlier we heard about the settlement of the opioid and other lawsuits. In this case, it's a tobacco settlement. It's always great to see that our lawyers are making us money for our county. Yes, thank you. And I see Greta here smiling since she was from the county's counsel's office previously, so thank you for that.
Oh, thank you. Yeah, I had the great joy of working with the whole county council team throughout the opioid litigation process, as well as our partners in other jurisdictions, and it's been very gratifying to start seeing the fruits of that labor start to roll in, as we've seen in a couple of other instances where we've been able to make significant programmatic expansion possible through some of those funding streams. So thank you.
Yes, and those are years and years of litigations and reams of papers and briefs, right? So thank you. All right. I think that's all the questions I have on this one, and we have a motion with second. Let's go take the vote.
Vice Chairperson Ellenberg?
Yes.
Chairperson Lee?
Yes, as well, and the report has now been received. And look like we have already moved toward to the next item, which is basically adjournment. Taking us to the end of adjournment, we just want to remind the public that we are actually going to meet in March for our next meeting, since February was canceled due to some scheduling conflicts. The next meeting will be scheduled on Thursday, March 16, at 2 p.m. Right here at the Board of Supervisors chambers. And I believe we might have some updates also regarding potentially going to hybrid for that meeting in the future. Is that correct, Jeff?
My understanding is that the clerk of the board will be ready to do it by then.
By then, right. So hopefully we will be able to get hybrid so we could have comments from the public from calling in or Zooming in as well. All right. And no further comments from my vice chair. I would just say thanks, everybody. And we're done with our agenda today, and see you in March. Thank you.